the glucose tolerance test, we're going to follow basic recommendations for urine collection with special instructions required for the test. Always confirm patient is fasting, so they need to have not eaten or drink anything, usually for about 12 hours. Make sure they performed on time. All tests should be collected at the same time in order by the facility recommendations. If not collected on time, document the reason why and the actual time of the collection. Postprandial test, this is going to require a patient to void or to urinate and then eat a meal. And then it's collected 2 hours after the patient eats a prescribed amount of carbohydrates or glucose solution. This test is going to monitor the effects of a prescribed insulin dose in patients with diabetes mellitus, also used as a screening tool in non-diabetics. With the 24-hour urine collection, the patient is going to receive a container. It's going to have a lid. It's going to be large enough to hold 3 to 4 liters of fluid. The patient will void and discard their very first morning urine specimen, and then they will initiate that collection process. So again, they're going to void that first one in the morning, then they're going to collect everything else for the next 24 hours. We need to explain to the patient any special instructions and when the specimen is expected to be returned and if refrigeration is needed. Drug testing, we use this to determine what non-prescription drugs a patient has in their system. A chain of custody form can accompany the collection process. The form needs to be completely filled out. Everyone who handles a specimen must sign and date the form. These tests can be used in court, so we need to be sure to understand and perform all the steps that are required. With the clean catch midstream collection, it's going to require the middle volume of the urine. So the patient needs to be informed to void a small amount of urine in the toilet and then begin that collection. That's a very important step because we don't want that first bit of urine. We need that middle volume. Culture and sensitivity. So there will be additional instructions that will be given to prevent bacteria from the labia or the penis. The use of the antiseptic wipes to cleanse the genitals prior to collection is very necessary. And really explaining to them how to do that. We can't just assume that everyone knows. Regent strips, those are going to come in a bottle, and it's going to be a little plastic thing with different, I guess, almost like a little pad area, and there's going to be multiple of them. Those are going to test for the detection of one or more, it could be leukocytes, glucose, ketones, bilirubin, blood, specific gravity, protein, and so on. So that's a quick test that we can do to kind of get a baseline while we're waiting for the actual sample to be analyzed. Other non-blood specimens that we may perform would be collections of saliva, sputum, fecal, semen, throat, and buccal. Our saliva specimens are going to be used to test for hormone, alcohol, and drug levels. This saliva is going to be collected, the saliva is just that spit, basically, that's in our mouths. Not to be confused with sputum. So our sputum specimens are going to be collected from the lungs, the trachea, and the bronchi. So to collect those sputum specimens, the patient's going to take a deep breath, then they're going to expectorate by coughing deeply and spitting the thick matter from their lungs into the specimen container. So think about when we're sick, we have all that chest congestion, and when we cough, we're coughing up that ooey gooey stuff. That would be what we would be collecting in that sputum specimen. Fecal specimens or stool samples, those are going to be collected to determine if the patient has any possible bacteria infections. We could be looking for parasites, and then occult blood. And there may be some specific dietary instructions that have to be given to the patient for them to follow prior to collection. Semen specimens, we may use that to perform sperm counts to help assess fertility. And then we also use those semen specimens for providing identity in rape cases. throat swabs, that is a culture specimen usually obtained to test for strep throat. So when we do that, we're going to take that swab and swab both sides of the tonsils for that specimen. The buccal swab is a little bit different than the throat swab. We're actually collecting from inside of the cheek in the mouth, and when we do a buccal swab, we're collecting the patient's DNA. Make sure as you kind of go back through these videos that you write down any questions that you have and email me them, and I will answer them as soon as I see them. And then next week we will look at a couple of the different specimen containers, and we will possibly do the blood smears in class so you guys can kind of see how that works, and we'll get the microscopes out.